Hi there, this is Dr. Hockman. I'm the medical matchmaker, and I help doctors find jobs where we can actually practice with autonomy and have flexibility and really just enjoy the life of a doctor. And today we are speaking with Dr. Ann Huntington. We are going to challenge some conventional thinking. We're going to explore new perspectives. And we have Dr. Huntington, who is breaking barriers on essential oils. So, we are in a profession that is very skeptical by default. I am absolutely one of those people. So, I'm very excited to speak with her. She has quite the expertise and open mindedness, and it's opened new avenues of healing and wellness. So, let's discuss the fascinating world of essential oils and see how they can complement medicine.
Wonderful. Thank you so much for having me. I'm excited to be here.
Yeah, thank you for coming. Well, tell us a little bit how you got into essential oils.
Yeah, absolutely. And I'll kind of just give a little bit of an intro to my career as well. So I'm an internal medicine physician and trained in large academic institutions, and I've been in tertiary care medicine for more than a decade. I have done a lot of quality and peer review and leadership and credentials. So that's kind of a little bit about my conventional medicine background. And then in my outpatient clinic years ago, I really started becoming interested in lifestyle medicine because I saw that, pharmaceuticals and procedures couldn't fix everything for my patients. And I was really interested in helping them optimize their health and really improve their quality of life. So I delved into lifestyle medicine, which many of you know involves healthy nutrition, exercise, sleep, all of those important things that can actually help control chronic disease and help even reverse some chronic disease. I was also interested in the integrative medicine aspect when many of my patients would bring in all their supplements they were taking and they would ask about them and they would ask if they were safe. And I was always worried about how they interacted with their medications and what the side effects were and what was actually in them. And I had been given no training on that. So I was really trying to help my patients the best way possible, but I felt at a loss to do so in many aspects. So I started learning on my own and really started researching and gaining experience with that. And along the way, I discovered essential oils. And as many physicians listening to this and many other people, I thought, I didn't know anything about them. I really thought this is kind of weird. It's kind of woo. Is there anything to this? And I thought that for a really long time. And I even remember having a patient in my clinic who told me she was using essential oils for something. And I just, as as a physician and in other settings, you kind of learn to really be supportive, but also mask some of your real feelings. And so I kind of had a poker face and just raised an eyebrow and just looked at her and said, I don't know anything about these. I've heard they can cause skin irritation, but I can't really advise you on these. And so she kind of dropped it and we continued on with the rest of our conversation. So that was my experience until, for whatever reason, my kids just had a kind of a mild cough and a little bit of congestion. And I reached out to somebody who I knew had essential oils and asked her if they would potentially help for this. And I knew that, it was self-limited. I just knew that we might have a rough few days. And if there's anything that could help them feel a little better, I was up for that. So she sent me home with a diffuser, which is a kind of a water reservoir that can vaporize essential oils, and some samples, some little bottles of certain essential oils that can help. Eucalyptus was one, I think a little bit of peppermint and some others. And she taught me how to use it. I was like, okay, at that point I'd done enough research to know that they were reasonably safe. And so I was like, all right, I'll give it a try. I didn't expect anything. And just when they were going to bed, started to diffuse it in their room. And I noticed that their coughing subsided, their congestion subsided. They went to sleep fairly easily. They didn't wake up in the middle of the night, but several times as they often do. And they were, significantly improved in the morning. And I knew that was, that was not enough evidence, in my doctor mind to say, all right, I'm sold. It was really just one experience, but I saw it happen in those few minutes where I was waiting outside the room. I was just like, oh, I wonder what's going to happen, if anything. And just noticed that it did something. So I realized they were biologically active in some way and I needed to learn more. And at that point, I started learning and studying and researching. And as a physician, I was most concerned about safety. That was my number one concern initially. And then I started learning more about efficacy and quality and kind of all of those aspects. We can talk, about some of those aspects. But that was kind of my first experience coming from a true skeptic, and even truly, I didn't even recommend any vitamins to my patients initially unless they had a true deficiency, to learning much more about integrative medicine and about, how some of these integrative tools can augment some of the other things that we do, and help us optimize, try to optimize our health.
Yeah, that's interesting. And then what I find interesting is that you say, I was so skeptical, I didn't even prescribe vitamins, and here you are, promoting essential oils. What are some things you found that surprised you?
Oh, so many things. I will say one of the things that surprised me the most was how much people were using these and supplements to try to work on a lot of issues that they had. I was probably pretty ignorant for a long time on the lengths that people were going to really try to help themselves, and some of the practitioners out there that were trying to help people. And I was surprised at the lack of evidence that I saw about some things. And I was also surprised about how people really didn't like doctors. I was, it was just an interesting experience to kind of explore that world and really figure out, there's something to this, and I want to preserve what is truly honest, and what could truly help people, but also help bridge the gap between what our patients are wanting and what, physicians sometimes mindset, but also our training and kind of the landscape in this country, at least, is making it difficult to kind of have a really seamless exposure and knowledge sometimes to really helping folks who have significant illness in a chronic, kind of long-term situation. If that makes
Yeah.
sense. Those are
Yeah.
some of the things that initially surprised me.
Yeah. What are some of the risks that you know of for using essential oils?
Oh, good question. It really depends on the quality, and it depends on what you're getting and how you're using them. So I'll kind of give a little bit of an overview of quality, because that is key in this. Essential oils are thought of as snake oil by many people, and they actually truly are snake oil in many cases, because many of the, there's such a big topic now, and they're so hot on the market, and so many personal care items, and in shampoos, and in lotions, and in so many other things and supplements, and the market is unregulated. And so there's a lot of money involved, and there's a lot of dishonesty. So many of these are not truly essential oils that would have the chemistry that can get therapeutic benefits. So they're diluted. They are passed off, potentially diluted with vegetable oil, diluted with lesser expensive essential oils. Sometimes the chemical constituents are made in the lab and added to the essential oil to enhance the aroma or enhance different aspects of it, and to stretch the true native essential oil to make it more profitable. So there's many concerns with that. Sometimes you might even find petroleum byproducts or pesticides in them in a concentrated form. So you really have to know kind of what you're doing, and the lack of standardization can really affect the quality, and can really affect safety, and can also affect the therapeutic benefits that you might achieve from using these. The most common safety risk that we hear about is skin irritation, sometimes contact dermatitis, and others. Essential oils are pretty strong, especially if you're using a true therapeutic essential oil. They can irritate the skin. Some of them are very, very potent. We call them hot oils, like oregano or thyme, or there's many others, and cinnamon, and they can really, really irritate the skin. And so for new essential oil users, I really typically don't recommend those ones, because you have to know what you're doing. For more experienced essential oil users, they may dilute them very heavily with what's called a carrier oil, which is typically a vegetable oil, like fractionated coconut oil, or macadamia nut oil, almond oil, or some others, jojoba oil, to reduce the skin sensitivity, but also to help improve absorption of the essential oils into the skin. That's probably the biggest risk that we see. And there's certainly others. When I teach physicians about these in depth, we look at the research on what some of the case reports are that are, concerning for, more extensive risk. And so that's really important, I feel like, to be educated on, if you're going to use these, learn about what they are and how to use them. And I shared with you earlier, and for everybody that's listening, I actually had a patient with an allergic reaction to some type of lavender spray. And I don't know if it was a true essential oil that was being used, but she had actually had an allergic reaction to a lavender in the past. And somehow she came in contact with this, and really she required quite a few medications to calm down that allergic reaction. And so those can happen as well. And it may be some of the other chemicals that are added to these products, but it could, in rare cases, be the actual plant as well that they're allergic to. So those are kind of some basics to get started, that we always have to watch for.
Yeah, that's so crazy. At one point, in my kids' schools and preschools with, 2-year-olds, every single classroom had an essential oils diffuser in them. And, being a skeptic physician, I was extremely uncomfortable with this. I didn't want anyone to get an asthma reaction, or I don't want my kids medicated without my consent. If it is actually, biologically active and has an effect on their calmness, that's kind of like, well, I don't want my kid on Xanax, so why would I want them on that?
Yeah.
And I think it kind of put the school at a little bit of a risk as well if anything were to happen. I don't
Mm-hmm.
know, what are your thoughts on that in schools?
Yeah, it's a great question. I know that some teachers are using them more and more. Um, I think whenever, and I'm a mother too, I have several young kids as well. And so whenever I think about something my kids are exposed to, I'm always cautious, and I always want to learn more, and I want to understand, and I want to be able to make that decision on what they're being exposed to. Um, I know that, kids are often exposed to different chemicals in the classroom, different cleaning supplies, which can have potentially adverse reactions. Usually they don't. And, certainly there's food allergies that we always have to be cautious about. So I think it's something that parents need to be aware of to be able to, help influence what their kids are being exposed to, because as you said, these can be biologically active. And in general, they, especially if you're getting a really low grade essential oil, they might just smell nice and might, help the kids be potentially a little more calm, or might, help them be a little happier. And research has shown that and has backed that up. But there could be some adverse effects. And so, you'd want to be able to weigh in and have a, you know, just have an informed decision, I think, collectively. So I agree. I agree with that concern. And you don't know what quality they're using. You don't know what's in them. And so I think that's a concern.
What I find interesting is that when you're talking about it, you're mentioning research studies, and there's actual research.
Yep. So there are over 22,000 research publications on essential oils. And I didn't know that number until I started delving into it. It was really interesting. They're done kind of all over the world. There are a lot of research. There's a lot of research done in Asia. Many of the countries that use a lot of natural products are often really interested in doing the research to find out, hey, we've got this product that's been used in our country for millennia, sometimes centuries, but sometimes millennia. Let's find out more about what the chemistry is, how it works, what are the risks, what are the benefits. And so a lot of places are researching these more and more. Lavender has over 1,000 studies, maybe over even 1,500 at this point. Lemon essential oil has over 1,500 studies. Peppermint has hundreds. So there's many research studies done on essential oils. The research is different than what we're used to in our conventional medicine. I am always looking for the highest quality research, the human clinical trials that are randomized, that are randomized controlled, that are double-blinded, placebo-controlled, et cetera. There certainly are hundreds of those types of studies. Some are, I think, conducted better than others. But there's so much more research that needs to be done. But there is a lot on the chemistry of the oils, on safety, the toxicology. There's animal studies that are done, and there's clinical trials that are done as well. So it's been really exciting to delve into this and to learn, and to just think of the possibilities, because these are reasonably safe. Kind of think of the possibilities of what these potentially can do as we learn more, and as physicians become more educated and are able to see this as kind of an adjunctive potential tool. It's pretty fun to kind of just think about.
Why do you think it hasn't made it to traditional medical practice yet?
Well, none of us were trained in it, right? We weren't even trained in nutrition.
True.
We were trained in pharmaceuticals and there's, probably won't get into some of the politics of it, but I think there's, certainly different things at play, and there's certainly different thought processes. Many of these communities have used plant products as therapy for hundreds and thousands of years. My colleagues who have trained in places like India and other places, they're very familiar with different plant products in their food and in their different traditional treatments. And so this is less foreign for them, and much newer for those of us who grew up and trained in the United States. So I think there's, exposure, lack of exposure is one of those things. We've also, and as a hospitalist, I've had a lot of patients that are trying natural treatments and it doesn't work, and they come in and their disease process is much worse, or they have a complication from their quote unquote natural treatment. And there's, so we're often skeptical just because of what we see clinically, where people are trying these things, they don't know what they're getting, and there's not enough research to show that they're safe or that they're effective. And so we're just cautious because we want our patients to be safe. That's our job. We want them to feel better, and patients want the same thing. They're just, sometimes we're, more willing to try different things that are maybe less evidence-based, and oftentimes it can go okay. So I think it depends on what your background is, where you come from, and mindset, and then our training. I think there's a lot of doctors that are heading into integrative medicine now and lifestyle medicine. So that is opening up, and people are much more open. And I've had a lot of doctors say, hey, I use essential oils, I want to learn more, which I've been surprised how many are actually using them now. So
how do you
it's
teach
pretty
doctors
interesting
about essential oils?
So this is one of the ways where I've fortunately been invited on for a lot of interviews for people to just understand a little bit more and just get a flavor for the research. I've created a course, which is, as far as I know, the most extensive course on essential oils for physicians, that really delves into the research, it delves into the safety, delves into kind of how to use these well and safely. It's an online course that's 4 weeks with several bonus lectures, and it's a CME, so you can get this reimbursed if you get CME money, but also it's just it's really fully based on research. And so I kind of talk about the things that are a little bit less evidence-based and make that clear, and then it's pretty clear on what is following the research. But it's a way for docs to really get a good exposure to this, and really understand what this is, why people are using these, why it's a multi-billion dollar industry, and that's probably not going away. And how to help keep our patients safe, and also some of the research on certain disease processes that they're not FDA approved, and they're not necessarily for treating or preventing disease, but potentially can they help people optimize some of their symptoms. I think there's some potential. So it's been exciting to teach docs from many different specialties and have them get this exposure and have them say, wow, I didn't know all of this went into quality, or all of this testing was necessary. I didn't know there's all this research. So it's been fun to see docs kind of open their minds and really embrace some of this, and then also potentially, help their patients get good results too.
That's awesome. And what is the course called, and where can they find it?
Yeah, so my company is Give More Naturally. The intent is to give more tools to help people. And my website is www.givemorenaturally.com. And then you can there's information on the course. So there's a link to the course. It's open now for enrollment. We're kind of doing the next cohort. So if people are interested, I invite you to check it out. Certainly can email me with questions at support@givemorenaturally.com, or find me on Facebook or LinkedIn. It's really fun to kind of see people, kind of come alive and realize a lot of possibilities. Pretty cool.
That's awesome. Where do you see, as this is all evolving, where do you see the future of this in medical practice?
It's a great question. I have run into several integrative physicians that are already using these in their practice. Even, separate from my course, some of them have already learned about this and done their own research and are using these in their practices. So I think folks who are more integrative minded, who have integrative practices, are using these. I know several health systems are using these. There's a lot of perioperative kind of nausea research and some other research for calming and for stress and for sleep. And there's even research about diffusing them in oncology waiting rooms and in EDs to help reduce some of the stress levels, help people be a little more calm in our stressful environments. There's a lot going. I know that some of the pediatric gastroenterologists are using peppermint, for example, for certain things in kiddos, and it's growing as we learn. We're able to appropriately implement the right things. So I think that will continue to progress. I think health systems will continue to use these. If they can use the right quality, then they'll get better benefits. And I see it becoming, kind of much more of an integrative tool. Most of our pharmaceuticals, about 70% of our pharmaceuticals are, derived from plant components or chemical constituents from plants. So this is not necessarily foreign if you look really into the chemistry of it, the biochemistry. But it does take an open mind, and it takes a little bit of learning. I tried to make it as easy as possible, and really kind of a one-stop shop to get a good foundation. So.
Well, thanks for doing that. Even I find myself still skeptical and still fighting the idea of, okay, I'm gonna look into it, but you've definitely opened my mind. So, for those watching, Anne and I met maybe a year ago, maybe a little under a year ago. And prior to that, I was completely skeptical of essential oils, and I still don't use them in practice or personal life yet. But I think, just kind of hearing you speak about it over time, I notice in myself this, like, there's a part of me that's fighting, like, no, essential oil's bad. And then there's another part of me that's like, no, open your mind. It could be awesome. So I really appreciate what you're doing. I think there's so much that needs to be known about essential oils in practice. And, I think so many physicians get this like intense feeling as soon as we hear the word essential oils.
We do.
And hopefully that comes to an end, and I hope that the research just keeps going, and we can really be trained on it. If it's helpful, we should know about it.
Exactly. I think it is really a mindset shift for a lot of people, because the industry is so interesting. You hear about it being sold, essential oils, you equate it with salespeople and with kind of multi-level marketing and all of those things. And that's been unfortunate, because if you look at the chemistry and the research, you can see a lot of possibilities. So I think as the field evolves, and as physicians become more aware of this, and and potentially others, it will change. It'll change the industry, and that's partly what I'm seeking to do, so that it can kind of go away from the sales aspect of it and really focus more on, like, how can we use this in a therapeutic and safe way. So I agree. It's I've had docs say, hey, I've used these for 7 years. I had one doc say, I've used these for 7 years. And other docs say, yeah, I've had a little bit of training in these, and some others. So there's more research for certain things. I would say also, nobody listening to this should think that I'm saying, oh yeah, this fixes everything. Absolutely not. I'm a hospital medicine physician. I save lives, routinely. And help treat very complex situations that essential oils have there's no role for them, right? There's no role for many of those things that I do, in my regular job. I think there's potentially benefits, though, that can go beyond some of those things, and more the acute setting, and kind of the, more at home. Like, what do you have when something mild pops up? You have additional tools for that. So pretty fun.
That's pretty awesome. Yeah, the field of medicine, I feel like, we're just starting. I feel like we probably know tiny percentage of everything that's out there to know.
Oh
or create or innovate.
Yeah, there's so much. Well, Laura, Dr. Hochman, I invite you to learn more. We'll have additional conversations, and and I can share more of the research offline, because I'm being super cautious for those who are listening, for the docs who are listening, not sharing the research in detail, because these aren't FDA approved, and oftentimes people who are not trained in research will kind of extrapolate sometimes the in vitro research or some of the lesser research to say, oh, it quote unquote treats this, and no, we can't say that. So physicians tend to not misunderstand those kind of things. So that's why I'm cautious online, but the course has far more really in-depth information on the research and the safety. So.
Awesome. I did steer away from any questions about diagnoses or treatments. So
awesome.
But thank you for coming. I'm so appreciative. And your website again is
www.givemorenaturally.com.
Okay, perfect.
Yep.
Anyone watching, please go check it out. It's
Yeah,
super
feel free to
cool.
join our email list too. We'll drop little gems as well and kind of educate as we go along.
Nice. Awesome. And thank you for watching. Again, this is Laura Hockman. I'm the medical matchmaker. If you're looking for a job, I'm